How do we connect with our patient? One of the cool ways to connect with your patients, very simple. All of you can do this tomorrow. When you're seeing a new patient and you're meeting a new patient for the first time, something will have happened before you met the patient. In our case, our new patient coordinator handles the first 30 minutes of that appointment. They haven't met the doctor. But however you do that, it's likely to be an assistant that's interacting with that patient before you see them. One of the goals for that team member is to learn something about the patient that has nothing to do with their teeth that they can share with you when you meet the patient for the first time. So that happens in our office. We have a new patient coordinator that does the first 30 minutes. We do a quick tour, we do an interview, we take photos, and we take x-rays. That's the first 30 minutes. And then the patient is meeting the doctor for the first time. And our new patient coordinator has to have learned something about the patient that has nothing to do with their teeth. And it might go something like this. Imagine that the patient's a male patient and his name is Dave. And Dave is now meeting Dr. Paul for the first time. Then Madi might say, Dave, this is Dr. Paul. Dr. Paul, this is Dave, our new patient this morning. And now she's going to share something with the doctor that has nothing to do with his teeth. Dr. Paul, I never thought I'd meet anybody that was as passionate about mountain biking as you, but I think Dave might be that person. He loves all things mountain biking. And now Paul's going to take that and have a short conversation with Dave about mountain biking. Oh, wow. What kind of bike do you ride? Do you have any favorite trails here in Phoenix? And they're going to have a short conversation. It might be 60 seconds. It might be 90 seconds. And just to show you, it could be all kinds of variables in terms of what we introduce. It might be an older patient that works in the same job as one of our other patients. Dr. Tim, this is our new patient, Maria, and she works at the bakery down the street with our patient, Sylvia. Oh, wow. How long have you worked at the bakery? Have you always been in that kind of a job as a baker? And they're going to talk about bakery. And so the idea is that we share something about the patient that has nothing to do with their teeth. And there's a couple things that are happening here. Naren, I'm going to put you to the test. Of the 6 fundamental principles of influence, as taught by Robert Cialdini, what principles at play here?
Liking.
Explain that.
We do business with those we like. So when we have something in common, we feel a sense of kinship. For example, you go to a foreign country, you see somebody from your same state or city. I mean, in your own town, you may not even notice them, but there they become fast friends. Let's say you have dinner and, oh, I'm also from Phoenix. Oh, that's so nice. And all of a sudden, you guys start hanging out together, even though you have no relationship up until that point. So it's a great way to, get people to like you, because the minute they like you, they're willing to listen to you. They see you as an ally. They see you as in their corner, which means they're going to accept treatment. If they don't like you, if they don't,
they're suspicious.
Yeah.
Well, of course, you're going to recommend I do that because you have something to gain from it.
Yes.
Now, there's another element at play. The other element at play has very much to do with neuroscience, how our brain works. We all remember high school biology, and we all remember the 2 modes that our brain is naturally in in any given moment. We're either in fight or flight, meaning that we're concerned, something's threatening us, and we need to fight or flight. And it goes back to caveman days when our survival depended on how we reacted to situations. And that's how the brain developed. And that's the hypothalamus. That's the last part of the brain that fully developed, that we still operate in that mode in a very different way. We're not being chased by saber-toothed tigers anymore, but maybe we're merging onto the freeway that's very crowded. What mode is our brain on when we're merging into the freeway where these, very crowded, people are honking? What mode are we in?
Fight.
Fight or flight.
Yeah.
The other mode is rest and digest. Rest and digest. So the brain switches subconsciously from one side to the other. And so rest and digest is when we're safe, when we're comfortable, when we feel at ease. What mode do you want the patient's brain to be in when they're in your office? You want them in fight or flight, or you want rest and digest?
Rest and digest.
So when the patient is talking to Dr. Paul about mountain biking, where's their brain?
Rest and digest.
When the patient's talking about the bakery she works at with her coworker, she's in rest and digest. Maybe we share with Dr. Paul that, our patient Linda has an 8-year-old son just like you, Dr. Paul. They talk about 8-year-old boys, things they do with their 8-year-old sons, and they're in rest and digest. They're in a much better spot to hear you. Now, let's also talk about the role of emotional intelligence.
Can I add one thing, Gary, to what you just said?
Please.
So let's say we talked about liking, we talked about rest and digest. The other thing I want to mention is there's 2 ways to get people to like you. One is we have something in common, and that creates a kinship, especially if you talk about it and you go into it. I mean, the book, How to Win Friends and Influence People, right? Talk about the things they want to talk about. And now that it's both something you have in common, it makes it really interesting. The second thing is we like those who care about us. Now imagine you remember that and you bring it up the next time. Hey, I know you mentioned you're going on this race. How was that race? Hey, I know you mentioned your son, who, let's say that's the favorite topic for mom, was, going on this camp. How was this camp? So like remembering and bringing that up, I think when they know you care about them genuinely, when they know that you really have taken interest in them, they really start trusting you. That again increases case acceptance.
Yeah. Well, let's talk about a construct all of you can use in this. I'm going to suggest a 3-part construct. And this is for that middle type of dentistry where it's asymptomatic, but it doesn't hurt. Remember, we want 70% case acceptance on that? Right. I'm going to suggest a 3-part construct. Number 1 is to give control back to the patient. Give control back to the patient. Patients are afraid of something happening in the dental office that they didn't approve. So we want to give them control. And one of the ways to do that is a simple language that you're talking to the patient. Something like this. Linda, I've had a chance to take a look at the records that we've gathered today. Maybe we've taken photos, we've taken some radiographs, we've taken some records. As I look at these records, I kind of look at it as I have a job to do and you have a job to do. So my job, your job. Linda, my job is to identify areas of concern and provide treatment recommendations that are in your best interests. And your job is to decide what, if anything, you'd like to do about it. Does that sound fair to you? And what's everyone going to say?
Yes.
Yes. Yes, absolutely. And so that's construct number 1. My job, your job. My job is to identify areas of concern and provide treatment recommendations that are in your best interest. And your job is to decide what, if anything, you want to do about it. Now the patient's in control.
Yeah.
Secondly, now we're going to use a permission statement as we're going through the photos with the patients. Remember, we talked about those 6 digital photos and we go over the photos with the tablet's in their lap. Linda, as I am looking at these photos, do I have your permission to point out every area of concern that I see? What have I now gotten? I've now gotten the second yes. The second yes. I got a yes on the first question. I got a yes on the second question. Yes. The patient's never going to say, oh, no, if you find something, keep it a secret.
Right.
Tell me about it.
Do you let them talk about the things they see on the pictures before we do this?
Absolutely. They have already gone through, and then you're going to say, may I take a minute and go through these photos and point out every area of concern that I see? But of course, they've already spoken first about their concern.
Would you reinforce the things they see as well? Let's say they have seen 3 things, crowding, let's say, and would you start with those? Would you reinforce those first?
Rather than reinforce, I'd ask a different question. Okay. So, I didn't realize my lower teeth were so crowded.
Mm-hmm.
Linda, does that concern you? Well, now it does. Now that I see it, then you're off to the races.
Right.
So that's the second. The second construct in this, as we're going through the construct, is so first construct, my job, your job. Second is a permission statement. And then finally, you want to make sure the patient is involved in the decision-making. If it's their idea, like anything, and by
They're
the
gonna
way,
do
this
it.
has to do with our team members. If it's a team member's idea to do something in your practice, what's going to happen? It's going
Gonna
to
do
happen.
it.
Yeah. So now you say, Linda, as I'm sharing with you what I see, I'm going to divide it into two buckets. One bucket I'm going to call necessary dentistry. And this is dentistry you should really take care of as soon as you're able to, And the second bucket would be things to consider. Now, in terms of necessary dentistry, here's what I recommend. In terms of things to consider, this would have more to do with ideal optimal care. So now that 3-point construct. Number one, my job, your job. I've given control back to the patient. Secondly, we use the permission statement every time. The answer is going to be yes. And third, we help the patient to become more involved. Now, as we wrap up this coaching and action segment, I want to provide an adaptation of this for comprehensive care. Remember that comprehensive care? And Aaron, I'm going to quiz you. What are we looking for case acceptance in comprehensive care? What percentage?
Case exceptions for comprehensive care, you said it's 30 to 40%.
30 to 40%. So now imagine an older patient that has lots of old dentistry in their mouth, severely worn dentition, but nothing hurts. And that patient hasn't identified that they're interested in getting this fixed. You might say, Bill, it's clear to me, and it might be evident to you, that there's a lot of things going on in your mouth. But before I just present a treatment plan to deal with those, I'd like to ask you a question. Bill, is that okay if I ask you a question? And what's Bill going to say? Sure, Doc.
Sure.
Yeah, you bet. And this is where you can tailor it to them. Let's say Bill is in his 60s. And in the conversation you've learned about the patient that Bill has recently moved, Bill and his wife have moved to your town to be close to their kids and grandkids in their retirement. And so now that's going to be adapted to this. So now the doctor is going to say, Bill, you mentioned that you've recently moved to the area. What an exciting time of life for you to be close to your kids and grandkids. Now, it's been a long time since I moved, but I remember the last time I moved, there were a lot of moving pieces going on. And the question that I have for you is now the right time in your life to address what's going on in your mouth ideally? And then we shut up and listen. But instead of just saying it's now the right time to address it, if you can add color to it, let's say Maria, that they have 3 kids in college. Maria, with respect to the fact that you have 3 kids in college, is now the right time to address the concerns that I see in your mouth, ideally? And of course, you might say, yeah, that's why I'm here. We pre-funded their college education with 529 plans. That's why I'm here. I want to get taken care of. It's mama's turn. She might say yes. Bill, the grandfather, just moved to be close to his kids and grandkids, might say, yeah, no better time than now. Let's do it. But what might they say? What might Bill say, Naren?
Could say, I need to do this. I'm doing my roof. I'm doing that. And maybe we can talk about this in 6 months. Or,
And then, so if they say now isn't the right time, you can say, well, here's what I'd like to do. Bill, I'd like to get your commitment to regular hygiene appointments in our practice. Now, assume this is the case. You have healthy gums. That means we'd see you every 6 months. I'd like to have a commitment for you to be faithful about keeping those appointments every 6 months. I'll come in every time, do an exam, and keep you posted on how things are going. And if I see things start to slide, I'll let you know, because the whole idea will be to take care of this ahead of time before it becomes a bigger problem. So now I've fallen back. Instead of just no, I've gotten a patient commitment to be faithful about their hygiene appointments. And that's not a bad fallback option.
Yes.
What will most patients, or Linda with 3 kids in college? Yeah, man, our bank account's running dry keeping these kids in college. Linda, yeah, I get it. I could actually answer that truthfully. At one time, I had 3 kids in college. I get it. Here's what I'd like to do. I'd like to get your commitment. You have beautiful, healthy gums. And now, if that wasn't the case, I'd have to say something different. But you have nice, healthy gums. That means we'd like to see you every 6 months. I'd like your commitment to a regular hygiene schedule in our practice. I'll come in every time and do an exam and keep you posted on how things are going. And I'll let you know if things are starting to slide, because the idea would be to take care of this before it becomes a bigger problem. Linda, does that sound good to you? Yeah, that sounds great. So there's some concepts that will help you regarding increasing your case acceptance. Darren, as we wrap up this coaching and action segment, I know we've got more questions coming up in the Q&A segment. Let's hit pause here and address those questions that have been submitted by our listeners regarding case acceptance.